Hello, everybody, and welcome to Bioregulatory Medicine Institute's webinar on bioregulatory approach. My name is Kelly Kennedy from True Wellness from the Pennsylvania area, and I'm very excited about tonight's webinar for a couple reasons. One is because it's my first webinar, and I'm very excited about doing that, and the subject matter is my favorite of all time subject matter. And I also am very excited because I just booked my trip for Baden-Baden, including my plane ticket yesterday. For those of you who have not been to Baden-Baden, I highly, highly recommend it. It was one of the first things I did when we got introduced to this concept of medicine almost 13 years ago, 14 years ago. And it was like, those of you who have gone to holistic conferences, this is gonna Minnie Mouse that experience. This is, you know, 4 stories of a 2-block wide conference center with so many vendors and lectures, both in German as well as English. There's plenty of English seminars. So please think about attending. If you have any questions, I'm sure myself would be, I know I would be happy to answer them. And I'm sure Dr. Sharon Stills and Kim Chi Moyer, who are running the seminar, would also encourage any questions that you have about the trip rather. And I know there's still some savings that you can gather if you register soon. So I really recommend that. It's going to be a lot of fun. We're going to go to a castle. We're going to see labs, in addition to being able to spend all the time together. And it builds a lot of real good synergy with you and your colleagues when you do something like this. And you really need a team when you're working in this world of bioregulatory medicine. And it's open for both practitioners as well as clients. So if you have clients that are really interested, they're also welcome to attend. And then tonight, during this webinar, I do encourage you to ask questions. That's what this webinar is about. I can guarantee you I already know all the information that I'm going to go over tonight. But I want to make sure that everybody here in attendance is able to understand what bioregulatory really means. And that's what I'm excited about talking about tonight. So please go into the chat mode over into your right-hand corner, ask any questions. Just hit a question mark so I know that you're looking at it, so I know that you're there. That would be great. Thank you. And then I will take the questions at the end, okay? So I'm going to start off with, everybody can see my PowerPoint. So tonight, what we're going to talk about is understanding what the bioregulatory approach really means. You know, you've heard this term, you've heard integrative, you've heard functional, you've heard biological medicine, and you want to know what it means. So we're going to talk about bioregulatory medicine and what that entails. Why does this approach differ from other paradigms? You know, and how can I explain that to both my colleagues, other practitioners, as well as my clients? And how do clients explain it to their friends and family that are interested in learning what they're doing and why they're getting success? And then we're going to talk about different testing that is utilized through biological medicine or bioregulatory medicine, excuse me. And we're also going to talk about the different therapies and modalities that are utilized, as well as who's the perfect client for this type of approach, who is best suited to get the best success with this type of approach, and when's the time to start. And the last is what you can do at home to improve your regulation. And that goes for practitioners as well as clients alike. You know, this is one of those things that you can't do bioregulatory medicine without being part of bioregulatory medicine, which is exactly what we're going to talk about. So what is bioregulatory? I'm going to read this and then we're going to talk about different parts of it. So bioregulatory approach to health considers every aspect of the individual, particularly the aspects that affect the body, the autonomic nervous system. The autonomic nervous system is that thing in our body that controls everything else we do. It's the stress mode, the fight-flight mode, which is the concept of sympathetic, and parasympathetic, which is rest, relax, and recover. And regulation is the concept of this alternation between sympathetic and parasympathetic as life happens. So everything in life, each time anything happens, the phone rings, we get caught up in traffic, my slide won't move. Checking my emails, looking on Instagram, Facebook, getting a tax notice, any news, listening to news stations, bumping your arm, working out, babies crying, weddings, promotions at work, pollens blooming, exposures to cold viruses, dental fillings, tight-fitting clothes. These are all things that can affect our regulation that we deal with every single day, because that's what life is. It's about the ability to regulate and compensate for these stressors. If you think about something unpleasant, thoughts actually change our regulation. A TV show, a drama, anything and everything the body has to deal with or has to handle is the ability of the body to compensate for that internal or external stressor to create homeostasis or balance. The ability of the body to properly account for in the appropriate manner for this quote stress, both positive and negative stress, is proper regulation. The overcompensation or the lack of compensation or almost beginning not to compensate is the lack of regulation. And when you have a lack of regulation, then the longer you have that lack of regulation, the easier it is for disease to set in. And the things that people notice when the regulation is off a little bit is, oh, my bowels aren't working exactly right. I'm not sleeping right. My breath rate is altered. Maybe I've got a fast heart rate, or maybe I'm perspiring too much or not enough. And the longer these functions are compromised, the faster it is for disease to settle in. And, you know, as the norm, you know, that's what happens. When people first start to not regulate, they don't think anything about it. Like, oh, I just poop once a week. That's no big deal. You eat 3 times a day, you should poop 3 times a day. I mean, I don't hate actually to be so bold about it, but we don't talk about poop enough in our world. I think poop and sex, and we talk about more, and we would all regulate better. But regulation is the concept that if my body eats 3 meals, I should poop 3 meals, and I should get tired around 7, 9 o'clock at night, or at least begin to come down. And then by 10, 11 o'clock at night, I should fall asleep and wake up around the time the sun rises, 5, 6 in the morning. I should have nice, lots of restful feelings when I wake up and be ready to go for my day, be energized. And that's it. I get hungry after I'm active. I sleep after, you know, my full day, and I don't get a lull in the middle of the day. I just have nice, consistent energy throughout the day. That's proper regulation. But when people go, oh, I didn't poop yesterday, that's okay. And then they don't notice that because that's the new norm. And they do that over the course of a few months. And then all of a sudden it's, well, you know, I just poop twice a week. And then over the next few months, oh, it's just once a week rather. And that's allowing it to set in. Same with sleep, same with perspiration. Oh, I used to exercise and I would really sweat. No, exercise, I don't really sweat, or I excessively sweat. All those things are signs or indications that the internal system, the regulatory capacities are not up to par because something's failing a little bit from normal, natural circadian rhythm. I don't like the word normal, natural circadian rhythm. And the skilled bioregulatory practitioner, that's what their job is, to assess that system, start determining how well the body works before considering the diagnosis or even the symptoms. And I you know, if there's clients on the webinar tonight, or if you're explaining this to clients, they can take that the wrong way sometimes. It's not that their symptoms don't matter. It's not that their diagnosis doesn't matter. It does matter because it matters for where the body is kind of sending out the signals. But for us as bioregulatory practitioners, we're really always looking for, but what's the underlying cause to that symptom occurring? And that's our job, is to assess that autonomic nervous system, that sympathetic and that parasympathetic, and why is it going off? You know, why is the person not sleeping well? Are they stuck in sympathetic mode? Or are they sleeping too much and they're stuck in parasympathetic mode because their body just wants to heal from something they're going through? So the skilled practitioner is going to determine how well the body works before considering those symptoms. And then the ability to compensate or not, regulate or not, makes all the difference in every case. So, because that's really the only thing that heals. That's it. Anything that anybody gives you, and I say this without even looking at my sentence because I say it all the time, any potion, lotion, or pills or therapy that anybody does to you is simply to get your autonomic nervous system to work better, because that's the only thing that heals. And our job as bioregulatory practitioners is to nudge it in the right direction, to get the sympathetic flow to be appropriate, to get the parasympathetic flow to be appropriate, to live 90-ish% of our life in that parasympathetic mode. And yes, when our child is running over to the stove to put their hand on the stove, you should go into sympathetic mode for a minute. That's fight float. I gotta stop them from doing that. And then once you've stopped them, your breath rate goes down, your perspiration and your heart rate reduces, and you're back into digesting your food, resting, and recovering. So now we're going to talk a little bit about why does it differ? Well, why it differs is because a bioregulatory practitioner is actually considering the internal, the innate intelligence. A lot of folks call it innate intelligence, but that ability of the body to properly compensate for what's going on. And when you consider regulation, everything else you do works better because you're working within the operating system that makes everything work better. So if the regulation isn't working, any drug that a doctor gives you, any surgery, even perhaps therapy, supplement, anything in life can get a response that's less than ideal because you're not regulating it properly. And that's why bioregulatory practitioners get the better, faster results, typically because they're considering that internal system that heals, so that when they work on that side, when they're working with the body rather than trying to force the body to do something, they're allowing the healing to take over. So that's first. Secondly, we're coming from a science that was discovered discovered in the 1950s. Two different scientists in particular, and we'll talk about them in a second. But all the modern medicine, the conventional medicine, if you will, is all based upon Louis Pasteur. And, you know, I studied biology at Cornell University. I was pre-med. I wanted to be a medical doctor. I wanted to delve into that. And, you know, you know my story. If you don't, I encourage you to watch my testimonial on our website on brmi.online. But the point of the matter was that I was frustrated through my own personal health and my father's health. I realized real shortly, medicine has a certain amount of answers. They know how to cut it out, they know how to medicate it, and they know how to radiate it, and they know how to manage it. But they don't know how to heal it. And that's one of the things that the major thing that bioregulatory looks at is, well, the body heals. I don't heal. The doctor doesn't heal. The body heals. So how can we get that system to work the best way? And that system was developed in the 1950s. Louis Pasteur, germ theory, okay, that approach is from the 1800s. We've advanced to take men back and women back and forth from the moon and back to Earth. We carry these phones, we call them phones, that can check our bank accounts, that can pay our bills, that can take videos for us, that can document our whole life, that can, you know, essentially document our whole life as phones. But the medicine that we're working from is based in 200 years ago. It's illogical to me in honesty. And biological means life is logical. And it just makes sense that as we would progress, so would the science of our health. That doesn't necessarily seem to have happened here in the United States until the Bioregulatory Medicine Institute took hold, and now we're taking over. So, and here's why, because we understand that the body heals and that's it. And we're here to assist the body to heal and remove its blockades. The modern approach is 200 years old in the scientific understanding for chronic illness. Modern surgery and nanotechnology aside, because they're amazing, medicine really hasn't changed since the inception of the medicate it and suppress it theory. Cut it out, radiate it, and to regain your health. Well, bioregulatory approach is based on many different scientists. Anthony Béchamp, Professor Enderlein, Dr. Wilhelm Reich, they all looked in different microscopes, one in the late 1800s, the other two in the early mid-1900s rather, and they were looking at different microscopes, and what they realized is that there's space between these cells. It's not just the cells. They figured out we're bags of bacteria, which we all know, right? Everybody on the phone knows that we're more bacteria than we are cells. If you're not, please hang up now. Just kidding. If you're not, please read all of our information on our website and learn that. But the bioregulatory approach considers this bacterial body or this microbiome wholly as the influence of the autonomic nervous system, that regulatory system, and realizes that the environment that determines the behavior of those cells. So just so everybody's on the same page, I want to make sure everybody understands that. So the environment of the cells, the environment in which those cells live in, determines how those cells behave. It's not that a germ necessarily only comes from outside our body and attacks us and then our cells have to behave. Internally, if we're dealing with a lot of acid, we're dealing with a lot of excessive heavy metals, we're dealing with a lot of viral loads or bacterial loads, then those cells inside our body are living in that soup, and that's going to get them to change. So let's use an analogy. So I have one child, but he has a bunch of friends. and he has certain groups of friends and other groups of friends. When he's with one set of friends, he's roughhouser and, really like wrestling all the time. And, it's a bunch of older boys. And then he's got this other set of friends where he likes to play house, and he likes to, and my son's only 5, and he likes to color, and he likes to draw. And, that's a little boy that's a little bit younger than him, and a young girl. So the environment in which my son is, he finds himself behaving very differently. Our cells are no different. It's a microcosm of the macrocosm. Our cells behave given the environment in which they live, okay? And this is the science that separates bioregulatory medicine and conventional medicine that's based on the germ theory from Louis Pasteur. If you don't understand all that, please email me. I will give you some more information. Go online, read about these different individuals, understand the work they did. I know Dr. James Odell's website's fantastic for understanding that as well. So there's a lot of information out there. But that's really one of the main differences between why we get a different reaction, because we understand the regulatory capacities, and we understand that our job is to influence or change that internal environment, and the influencer of that internal environment is your autonomic nervous system, your sympathetic and your parasympathetic. So think of a computer, an operating system. If this body is the body we've been given, so it's our computer, okay, and the operating system that runs it, that it comes with, is the innate intelligence, is the autonomic nervous system. And we can work with that system, right? And we download new software, which is medications, surgeries. We can suppress our feelings. I learned a lot about that being raised the way I was. And we can try to force the computer to behave the way we want it to. When we meet a client, we look at these computers and go, oh, we need to defragment this computer. They've got some bad thinking in there. They've got some heavy metals in there. They've got some viral loads perhaps in there. They've got some scars. They've got dental fillings. We've got to defragment this computer. We've got to get that operating system less congested. So let's take some of this software out of the way and get it back to its original operating system. And that's really what we do when we work with a bioregulatory approach. So how to explain this approach? So there's a lot of terms out there beyond bioregulatory, and the term integrative, functional, holistic, alternative. I'm going to read these slides a little bit, and then we'll go through just like I do and, do my thing. So the integrative practitioner is utilizing the same paradigm of the germ theory, yet they give credibility to massage, chiropractic, homeopaths, for instance, as adjuncts to assist their chemical-laden pharmaceutical solutions offered by their modern medicine. This practitioner is going to incorporate perhaps some lifestyle suggestions, such as exercise, nutrition, acupuncture, and the like. But they're still going to put you on your Lipitor for cholesterol, for instance. They might also integrate and give you some red yeast rice also for that cholesterol. But they're not going to depend upon that, because that's not their understanding. That's not what the PDR says that they should give them. That's not what the insurance company says. So in order for them to charge your insurance company, they got to give you their Lipitor for the cholesterol. And they're hopeful, as an integratively trained doc, that you're also going to exercise, change your nutrition a little bit, and maybe seek out some alternative therapies, integrative therapies like acupuncture to help with your lifestyle. The holistic, the alternative, the complementary practitioner is the one that dependently utilizes one or more of the adjunct therapies as their approach to assist the patient, the client, to not be as dependent upon the chemical drug, the drug therapy or the surgery approach. So this category of folks is like a hydrocodone therapist, an acupuncturist, a chiropractor, a homeopath, a nutritionist, a yoga instructor, and they often find themselves referred to by mainstream practitioners. They'll often make suggestions that will change long-term to affect the blood work, and then ask that the primary practitioner get back involved and help them get off the chemical. But they're the practitioner that's going to help you make your lifestyle changes, maybe make your nutritional changes, give you some other concepts of thoughts, give your body some information with homeopathics, for instance, or get all your circuits working from your chiropractor, or get you more zen with your yoga, which is going to change that internal environment. Therefore, the drug that they're giving you is going to work better, and therefore you also may not need it because it's going to help your whole body deal with better, but it also might over-medicate you because it's going to work better. So it's one thing, it's going to happen on both ways, that you're going to get better if you take on some lifestyle changes like that. The functional practitioner is looking at the root cause of the illness. So they're concerned about fighting out the entire unique picture for each person and considering the physical, genetic, the microbiome, the lifestyle choices, the nutritional, and the emotional components. This practitioner makes a very detailed and complex program for a return to optimal health. And the functional practitioner is also still coming from that germ theory, but from the American approach, that's probably the closest to a bioregulatory practitioner, although they're still not looking at regulation. They're still not looking at the blockades to regulation. They're still missing a few of the pieces, but they're definitely incorporating all the aspects, understanding that that environment is what they're trying to change. So the bioregulatory practitioner, like that functional practitioner, is concerned with finding the underlying causes to the illness. They don't want to just suppress the symptom. They want to know, why is this body going into this symptom? So the main difference between the bioregulatory practitioner is that they are looking at the blockades, dental foci, and scars. So root canals and silver fillings are the blockades and scars. Then that practitioner looks at the autonomic nervous system, and there's a lot of different ways to test about, which we're going to talk about, to properly assess that autonomic nervous system. But after the blockades are addressed, now we want to find out what's the load on that autonomic nervous system and how many of those typical stressors is this body up against. And the typical stressors are metal, chemicals, foods, and that includes water, immune challenges, and the emotional components. So those cause the inability of the body to compensate for that stressor. So it's typically not one thing that causes one thing. If it was, that would be so much easier, but it's just not. The body's more complex than that. The body's regulating. So the first time the body gets a little metal, maybe it's preloaded. I was born, a little preloaded. I only had one silver filling for 5 years, but the amount of mercury I've dealt with in my life is absurd. And not to throw my mother on the bus, but she has a mouthful of amalgams when I was born. And, I was like her last child, and there was a lot of time in between. So I'm sure I came into this world a little preloaded with a little heavy metal. And then I got chemicals. Oh yeah, we had those Glade plugins, and we had smelly candles, and we had all sorts of chemicals, the lotions. I remember in the 80s, I used to spray hairspray that was like so chemically laden. Foods, I didn't eat good food at all until 20 years ago when I got introduced to nutrition instead of food. Immune challenges, sure, we all deal with those. And then emotional components. So if the body's just dealing with one thing, it's cool. It's like, yeah, I got this. 2, 3 things, it's like, all right, I'm doing good. I can juggle this. 4, 5 things, at some point, and everybody's nervous system, or everybody's immune system rather, is as unique as they are, as unique as your fingerprint. So it doesn't matter if 2 twins that have lived their entire life completely together, one gets ill before the other because one's immune system is different than the other. It's unique as their fingerprint. But when the body's building up with all that load, it doesn't have symptoms because it's regulating, it's compensating. And then when it can't compensate, when that barrel overflows, that's when people see signs of illness. And they start to go, oh, I have to chase down this symptom. I have high cholesterol. And we go, yeah, but you have high cholesterol because your body's not regulating. That's what a bioregulatory practitioner looks at. We're looking at, you're not regulating, so you have high cholesterol. Do you sleep well? Do you poop well? Do you sweat appropriately? And if those aren't in line, then let's get those in line. You still have silver fillings. You have, a big scar across your abdomen from a C-section or whatever the case may be. Let's address some of the blockades. Let's get this handled. Let's get this immune system turned back on. Let's get it to address some of the underlying issues and watch the cholesterol dissipate. And then you can go back to your primary care and get them to get you off your Lipitor because you feel, now they're like, oh, your cholesterol's too low when they run a blood test. But every case is as unique as the individual. And once those stressors are addressed in regards to what's causing that regulation to not be proper, we always want to make sure there is proper drainage. We make sure that the affected part of the body is also nutritionally taking up whatever it needs, and any emotional cathexes, any emotional blockades are handled. Then, and only then, after the practitioner has assessed the regulatory capacities, their blockades, their drainage, their nutrition, and their emotional blockades, then the skilled practitioner can systematically address each underlying cause and allow the system to be less cluttered, less congested, and therefore able to compensate. Compensation is regulation. Regulation is not a destination, it's a daily occurrence. So every day when we wake up, we decide whether or not we're going to eat good food. Are we going to eat, trying to think of like Life cereal, which is good, but genetically modified and everything else, I'm sure. Or are we going to have Ezekiel on top of goat yogurt? You know, how are we going to make sure that our regulation is proper? Are we going to get up and meditate? Are we going to get up and drink a glass of water? Or are we going to get up late, hit snooze, run out the door without eating breakfast, barely get dressed, and run to work while drinking our coffee, get to work, and oh, I'm here? Or are we going to give our body the ability to regulate? And every decision we make throughout the day is a decision. Health is a decision, not a destination. I've been on this journey for more than 20 years, and I love what I do. I'm 44 years old, and I feel like I get younger every day. And I get younger every day because I work with my regulation. I work with my own capacity to heal. And we all have the capacity to do this. You know, that's one of the great things about the bioregulatory approach for me is fantastic, is that we're actually empowering people to handle their own health. And as practitioners, we all like that. We like the client rather that comes in and says, oh, you know, I did all the things you said, and then these are the ways that I felt. We like that involved client that understands their partnership in this path with us, and they are going to be the ones that get the best results. But as I mentioned in the beginning, we have to walk our walk, because this work that we do, it's challenging mentally, because every client, rather, is individual. We can meet 3 clients today, all with migraine headaches. They don't have an Imitrex deficiency. They all have the headaches for a different reason. So our job is to figure out why they have the headaches and then address it. And some people around ball bearings, you do 2-3 things with them, they go on with healing, everything is fine. Other folks, they're a little bit more complex. They need to address their emotional components, or they don't really know about their emotional components, or the fact that their emotions affect their health. They don't know that the food they eat actually affects their health. They don't understand that the silver fillings in their mouth. So it might take a little bit more education. But we're the first ones. If you have a mouthful of amalgams, if you have scars, if you're tired, if you don't sleep well, if you don't poop well, handle your own self first. Be your first bioregulatory client of your own. Do the work on yourself. Feel it, so you know the power you're putting in these people's hands. I could not work the days that I do, and I'm sure a lot of you work the same 12-hour days, often without breaks, which isn't very regulatory. But I can do it, and I do it well, and my HRVs and my CRTs, which we're going to talk about some of the testing, are better today than they were 12 years ago when I started doing this type of testing, because I take care of myself when I work that hard. So I have that stress and I take care of myself. I do saunas, I do foot baths, I do neural therapies, I take supplements, handfuls of supplements, and I take breaks too. I don't only live that way. And I went on vacation a few weeks ago, and I ate pizza and I ate ice cream, and I gained 5 pounds, and it was fun. It was great. And I was really ready to get back to my good regulatory life. So I want to talk about the different types of way that we test it. There's in-office and out-of-office testing. So in the office, we do a lot of biofeedback, dowsing, biofeedback. A lot of people have different types of technology that they use. We use a lot of muscle response testing or applied kinesiology at our center, but you got to find what works best for you. We use a heart rate variability. You know, a lot of practitioners in bioregulatory medicine use that. We also use contact regulation thermography, or the alpha, both extremely good for testing your regulation and your ability to compensate more in a very overall picture. The Vega testing, Kim Chi's brilliant with Vega testing. We're looking forward to more classes from Kim Chi. The AO scanner, there's a lot of different types of biofeedback. I just mentioned a few here. It's certainly not an all-exclusive test or list, rather. So I encourage you to send me something that maybe not on here, so we can continue to improve this list, because I think this is a good foundational subject for a lot of people interested in bioregulatory. So Biocom and Bemessin are both things that I know Dr. James Odell has familiarity with, and these are all just ways, again, to test that regulatory system. Now, that's all stuff you can do in the office. Out of the office, if you're working with a medical professional, professional rather, they can do blood work. They can do thyroid labs, EVV, co-infections, Lyme testing through IGenics, which is a company in California. But more than just, oh, give me your TSH. When looking at thyroid labs, for instance, often the docs that I've worked with, they like to look at T3, T4, and the antibodies. So this is functional testing out of the office, but it's looked at through different eyes from a regulatory standpoint. We do a lot of urine challenge tests for heavy metals. Our doc does a lot of saliva testing for the adrenals, different types of stool analysis, which there's a lot of debate about. SpectraCell, like for micronutrient testing, see how well the body is actually absorbing the good food that we're all eating, hair mineral analysis, and genetic testing. So these are all ways to get information, and whatever works for you is the perfect one. Whichever one you feel connected to is the perfect one. The therapies and the modalities that we use, again, not an all-inclusive list, but here's some of the things that you can look for at your center or at the one that you want to create, which is allergy elimination. That's a non-invasive vibrational technique to truly eliminate allergies. We've used it, I and my husband and partner has used that for over 30 years with amazing success, right down to anaphylactic allergies. Lymphatic enhancement, we use LymphStar. A lot of other folks like S8. Again, it doesn't matter what you use. It just matters that you're committed to your tool and you get really good at your tool for helping folks increase their own bioregulatory capacities. So allergy elimination, let's talk about that for a second. So what's an allergy? An allergy is anything in the world that vibrates non-harmoniously with my vibration. Everything in life vibrates. We learned that all in physics 101, right? Nothing is solid. It's just that our eyes are not able to detect how fast those molecules are moving, so it looks as though it's solid. But the reality is nothing solid. Everything has its own unique electromagnetic signature vibration, its own frequencies. Every apple in the world vibrates as an apple. A green apple vibrates differently than a red delicious apple, and there are certain computers that can detect this vibration. And a lot of there's a couple companies in the world that actually take that vibration and put it into these little vials. And a vibration, an allergy vibration therapy is when you take a vial that represents whatever it is, arsenic, apples, protein, vitamin A, vitamin B, calcium, whatever it is, and see if it regulates with this person with using your own biofeedback, seeing if it regulates that person or does it shut down the regulation. Shuts down the regulation, it's an allergy, it's a sensitivity. And what we're trying to do is get anything to harmonize so that we can properly compensate and regulate. Lymphatic enhancement, getting our lymph to move, doing lymphatic drainage is key. Drainage, drainage, drainage. It's not about detox, it's about drainage. When you drain out the toxic load from the body, the autonomic nervous system is less burdened and can work better. Scar therapy, however you do that, we use a rapid release technology. We use red light, and we also have our medical doctor use ozone and needle therapy with propane for scars. Light therapy, that's vast. There's a lot of different lights, red light, yellow light, green light. There's a lot, and not just the ones that you drive on the car with. That was red light, green light, yellow light. But red light for healing, green light for healing, and they have different capacities. There's infrared saunas, of course, that also give light therapy. Light is a great modality because light is how cells communicate, and everything's a vibration, and light is a vibration. Emotional release technique or tapping or EFT or whatever modality you have to handle somebody's emotional components. Cupping, moxa, acupuncture, sujok. These are all Chinese medicine or Korean types of modalities to alleviate stuck energy in the body. Nutritional counseling or orthomolecular medicine, that's putting people on really great high quality supplements. IV therapies, that's pretty vast. You have everything from vitamin C, ozone, Myers cocktails, hydrogen peroxide. I'm sure there's amino acids and there's a lot of different IVs. I can't even begin to approach, but IV therapy is fantastic. Nasotherapies, we do a lot of that at the center. That's a neti pot on steroids. That's really delving into that mucosal lining and getting into that, allowing the body's own capacities to open up and get more oxygen up there when you have less biofilm in the head. by doing these nasotherapies, allowing the regulation to occur. Neural therapy, prolotherapy, or live cell therapy, that's all administered by medical professionals that have licenses to do so. Very effective. One of my favorite things. The ion cleanse detox foot baths, infrared saunas, pulse electromagnetic therapy. A lot of folks are familiar with that. The Ozulite emotional biofeedback. I know Dr. Tom and Dr. Jeff Drobot, they use some other type of biofeedback at their center. I know that Dr. Sharon Stills uses a lot of mindful meditation. I know Dr. Odell uses a lot of different other emotional techniques. There's a lot out there. The bottom line is we have to address people's emotions because 80 to 90% of all illness is emotional. I'm going to take questions in about 5 to 6 minutes, so get those questions ready. Vibrational therapy, there's a lot of different forms of that. Inversion, just getting people upside down to drain. Salt therapy, and I don't mean salt rooms, but I mean salt therapy. We can talk more about that if you have questions. Massage therapy, myofascial release, chiropractic, structural, something of nature, yoga, tai chi, energy movement, mindful practices, hydrocolon therapy, fever therapy, which is allowed in certain states in the United States, and bioregulatory or biological dentist remediation. Should not be the last thing on my list. Should be the first thing on my list. Because if you don't have a good biological dentist you're working with, find one. If you don't have one, find a really good dentist that wants to learn. We need more dentists that know this information. That's all there is to it. Okay, at home, things that people can do at home. Castor oil packs helps drain their liver, gets their liver to work not as hard so it can take over to process all the detoxification it needs to as well as digest the food. Dry brushing, getting the lymph to move. Neti pots, again, cleaning that mucosa. Avoiding Wi-Fi, as we all sit here on our Wi-Fi listening to the webinar, but avoiding Wi-Fi and turning off AMAP, I made that up, as much as possible. I don't know if that's true, if that's a real thing, but that's my new Kelly Kennedy dictionary, AMP. Avoid it as much as possible. If you don't need your cell phone, turn it off, leave it in the car. It doesn't need to go to the bathroom with you. It doesn't need to go to the park with you. It doesn't need, if you're with your family, you certainly don't need it. You know, there's a lot of times that we can turn it off or we can avoid having our phone. And I think it just gets to be a habit. Grounding. People can do a lot of grounding and earthing and forest bathing. See, the thing is that when you tell somebody that they're going to be in a partnership with you, they're going to be in this relationship with you to help them turn their health around, it can be expensive. We all know it's out of pocket for them. They're all coming to our centers and they're pulling money out of their 401ks perhaps or different things to regain their health. And they want to know what they can do at home. There's a lot they can do at home. It's not just about eating the right foods and taking their supplements. There's a lot more they can do. And the more they do at home to get their own regulatory capacities to turn on, the better clients they're going to be for you when they come into the center. And then you're able to do some therapy to them. They're going to get more out of that because their regulation is going to work even better. And for all of us, we need to do this. You'll often find me in the middle of summer laying in the middle of the ground looking up at the sky, all of my body touching the ground. Grounding, earthing, forest bathing. I at least once a week go for a long walk in the forest. Otherwise, I don't feel human. I'm the original tree hugger, still am. Watching sunrise and sunset, it resets your circadian rhythms. You only watch it when it's a little orange out there and the sun's actually setting or rising, but it's very beneficial for you. Sound. So 528 hertz, if you're not familiar with it, you can download that on YouTube. And you can also purchase it, which I recommend. 528 hertz is the frequency, because everything vibrates, that heals your DNA. So the person's having trouble falling asleep. I don't love Wi-Fi, but they could listen to 528 and it would heal their DNA, and that could be in the right direction to allow them to regulate better. Coffee enemas. Another great way for a client to do that at home. Liver gallbladder flush is very similar. You're trying to just get the bowel to open and get that liver to work better. Essential oils. We don't really deal with essential oils a lot in our center because they're so prevalent now, and you don't need to be a skilled practitioner to use essential oils. Just be cautious is all I could say about the quality of the essential oils and the frequency. People forget they're treating when they use essential oils. So every day they're diffusing something. For those of you who have been pregnant, do you want to be pregnant every day? No, as beautiful as it is, you don't want to be pregnant every day. It's exhausting. You don't want to be treated every day. You got to give your body a break. Treating every day doesn't allow for proper regulation. Hot teas, ginger baths, Epsom salt baths, deep breathing, movement, and mindful meditation. These are all things that we can do at home. And I would say most of our clients get 3 or 4 of those things listed as a, hey, go ahead and do these things at home. So who's the ideal client for this world? Well, they've got to be ready, willing, and able. Ready because they want to change their life to prevent any illness. They've got to be ready because they want to help they want to help recover more when they're in athletics. Or they're symptomatic. Their sleep isn't ideal, their constipation isn't ideal, their allergies, they have mood swings, fatigue, joint pain, or stress. They have to be willing to make lifestyle changes. I talked to a gentleman, a cousin of mine actually a couple of weeks ago, his wife, who's my cousin, she really wanted him to do this, but he wasn't willing. He doesn't want to make changes. He's happy with taking his medications and feeling suppressed medicine. Then okay, this isn't going to be the right approach for you then, because you've got to be willing to make different changes in your nutrition and turning off your Wi-Fi or whatever. They're willing because they're willing to look at a different approach. You know, they're willing to go outside of the box and go, okay, I don't want to just suppress this. I don't want to just go to my primary care and get Lipitor for my cholesterol. I want to look at a different approach. They're willing because they want to communicate with you as their practitioner with all their feedback. Oftentimes I talk to clients and it's like pulling teeth. I don't consider that willing. You got to communicate. Now, emotionally, a lot of folks have the inability to communicate appropriately. Well, then let's show them how to communicate by leading them, by asking them the right questions, getting them involved. They're not accustomed to talking to a healthcare professional, perhaps. And understanding that it's a process, that this is going to take 2 years or more. If I work with a client, they're like, so how long is this going to be? Can I be done in 6 weeks? Well, depending on what you're dealing with, if it's chronic illness, you got to take 2 years or more. If it's, my elbow hurts once in a while for the last few months, well, yeah, that'll probably take 2 or 3 visits. But if it, I've had diarrhea for a week and that's it, fine. But if you've been chronically constipated for 5 years, it's going to take a little bit more. And able to actually take a role. Are they able to make their own food? Are they able to be involved in taking their supplements, be involved in doing their castor oil packs, doing their dry brushing? Are they emotionally supported? Is everybody in their life fighting against what they're doing? Oh, you're doing that hooey-fooey medicine, or, you're going to see the witch doctor, whatever. They've got to be emotionally supported. It might not be everybody in their life, but find 1 or 2 people that they can reach out to feel emotionally supported, because this is a lot. When somebody's turning their health around, they're going to go through some stuff. They're going to need a shoulder to cry on, and it shouldn't be yours. I'm saying that to myself too. I need to hear that. And financially resourceful. Again, this is all out of pocket. So, you don't want to start something you can't finish. And what I say to clients, it doesn't matter when you get started. It's just a matter of that you finish. And it doesn't matter when you finish. It just matters that you keep going in the direction towards your finishing. So let's say I'm in New York and I want to get to California. I can take a train, I can take a plane, I can bike, and I can walk. Each one's going to get me to California. Oh, I can fly too. And each one will do it at a certain speed and rate. So the plane's most expensive, or perhaps the train, and walking's going to take the slowest, but all of them can get me there. So money is not the excuse. Your time and your energy into it is the only thing that matters in bioregulatory medicine. And not medical wreckage. So if they're on 5 medications or more, you got to really consider whether or not that's a client that's really able to do this. Or are they so complex and so suppressed in their medicine that their body, it's going to take so long for them to turn around? Or are they overly willing to go through the process, to make the lifestyle changes, to go through it and really be diligent with the process? 5 medications or more, we caution clients to take on this type of therapy. So when's the time to start? Now. Oh, if not now, then now. Oh, not now, then now. Because what I was saying before is, if the person is trying to get to California, they're walking versus flying, just tailor your expectations. Listen, you're not going to get there in 6 hours. It's probably going to take you 6 weeks, but you can get there. What can I do now? So this is what we can do as practitioners, and this is what our clients can do. Get all the electronics out of your bedroom right away. There shouldn't be any electronics in your bedroom. Go get an old-time alarm clock and turn that on. if you need an alarm clock, or you can open your curtains and wake up with the sun. Turn Wi-Fi off at minimum at bedtime. I mean, we have the little router that comes into the house. We just turn it off at night. End of story. We don't need it all the time. So it's often off at our house. And when you turn off your Wi-Fi, you then have to go to each one of your devices and put them on airplane mode. Otherwise, they're going to still be searching for a signal. When you're searching for a signal, it keeps you in beta waves and doesn't allow you to get to alpha waves. And alpha waves begins you into sleep mode. Watching the sunrise and the sunset. Orange safety glasses actually are phenomenal fix for those of us who don't have the blue screen protection either in our glasses or on our screens. So if you're on computers, you're watching televisions after about 8 o'clock at night, go get yourself a very fashionable, gorgeous pair of orange safety glasses, and then watch your screens. You'll block that blue, which keeps, again, that circadian rhythm to not allow that circadian rhythm going. Eat for your blood type. Just as a guideline, it's not a Bible. Just begin to eat for your blood type, particularly for the foods to avoid. Meditate daily for 15 to 60 minutes. Every day. Praying, sure. Deep breathing, sure. Mindful meditation, guided, sure. Yoga, sure. Just quiet the mind down for 15 to 60 minutes every day. If you have to get up earlier to do it, that's when I do it. Deep breathe at least 10 times a day. If you deep breathed, then you have meditated. Good job. Eat lunch outside. Take a break. Go outside. We all eat too fast. I do it all the time. And then I go, whoa, I got to go outside because I only have a minute break between clients. It doesn't matter. I have to get outside and get some fresh air. It causes my body to change the environment in which it's in. It causes it to regulate. When you work out a muscle, it strengthens. So tone your regulatory muscle by getting it to change the environment which your body's in throughout your day. Change your bulbs over to be full spectrum. When we got our center, it's 5,300 square feet, and it was full of fluorescent lighting. And for the first 2 weeks, we couldn't work with the lights on. We had the lights off, and we finally ordered full spectrum lighting, which is brilliant. Excuse the pun. It's brilliant because now instead of just giving us blue light all the time, we get that full spectrum so that all of our cells are being fully communicated with all the time. We don't get that seasonal affective disorder. We feel great. The only issue with it, in all honesty, is at 8 o'clock at night. It's like noon at our center. So we have some ways to handle that. But it's easy now to change over any fluorescence to full spectrum lighting, and they have them in any kind of sizes. I think the website's fullspectrumlighting.com, but it's close to that. Forest bathe and ground at least every day. Just go outside and touch the ground, even if it's 10 minutes. I was in New York City at a training a couple months ago, and I wanted to ground because they did some therapy, and I really felt like I needed to ground. I was nowhere near. I was in Jamaica, New York, if you know anything about it. You're right next to the water, but there's no ground. I literally stood outside the hotel, found 3 bushes, stood in the middle of the bushes, and just grounded myself in that area because it was the only option. Do what you can and you have the opportunity every day. That's it. So I hope you guys enjoyed that. I'm ready for your questions, and I'm ready to see you all in Baden. So I want to go to that one. When's the time to start now? So let's see what kind of questions y'all have. Okay, good questions. Oh, I love questions. Okay, so first question is, when you do castor oil pack, do you do it every day, or do you need to do a cycle, 3 on, 4 off? So castor oil packs are messy, and I find compliance is a little light, unless what I tell people is this. Do 2 to 3 days in a row, every 2 to 3 weeks. My ideal is 3 times a week for about an hour to 2 hours at a time, all over the abdomen or just over the liver. I have a couple clients that sleep with them. I don't really recommend that. I think it's too much. But 3 times a week is ideal if you're willing to go through the mess. If you don't want to go through the mess, do it 2 to 3 days in a row, then put it away for 2 or 3 weeks. Then do it 2 to 3 days in a row, put it away for a couple weeks. Okay? Next question. How much castor oil do you use? Do you drench the flannel? Yes, or the cotton. And drench is saturated, not drench. There's a difference. You don't want it to be dripping off. You just want enough castor oil in that cloth and that cotton that when it sits against your skin, it's going to be able to absorb out, that it's saturated enough that it's going to be able to do its job. And then you put the heating pad over. I tell people just dedicate a t-shirt to the experience and don't worry about how messy it all gets. And, you know, you'll get a big benefit out of it. Does it matter if you dry brush in the morning or the evening? No, it does not. It just matters that you do it. Very simple answer on that one. I also recommend when you're dry brushing to actually stand in your shower, because it does release a lot of dry cells. And as a neat freak, I just, you know, don't want to clean up my bathroom more than I have to. When you dry brush, does the order matter? Oh, very good question. Should you do left side first and then your right? So I firmly believe you should always do your left side first, unless you have an issue at your right side. Then you should do right side first. So left side, unless there's an issue, then you do the right side first. But the next webinar that we're doing is on August 22nd, which Dr. Sean Riddle's doing it. He's amazing. I really, really respect Dr. Sean Riddle. I've known him for quite a few years. I know he's taken a lot of these, he's taken a lot of classes with us at the same time. He does a lot of great techniques up in Canada, and he's going to be talking online, and that is not going to be one to be missed. I highly recommend that. And invite your clients to it that either have Lyme or know somebody that has Lyme too, because all of us being educated is only allowing us to take faster hold over this bioregulatory, you know, over the world with bioregulatory medicine, rather. What do I think is the greatest challenge I face as a bioregulatory practitioner? It's swimming upstream all day long, every day as salmon, but I rise to that challenge. I'm not a status quo person. I was told I could never get into Cornell, so I did. Like, that's who I am. And when all of us are faced with clients, and some of you are doctors, so you have patients that aren't getting better, those are the clients that make me so excited about what we do. And the challenge that we have in bioregulatory medicine is that it takes an education. We spend, what has it been? It's been 1 hour on the phone tonight. I really wanted to do this in 45 minutes, but it's been an hour. And an hour of just understanding the basics, you know, and for a medical doctor or somebody who's already gone through a lot of schooling, it's a lot for them to take on a whole new science of understanding. However, it's also their best gift they've ever given themselves. I really, really encourage you to understand that, because while it is an uphill battle, it's also the most rewarding for those clients that have been everywhere, tried everything else, can't get fixed, and then they show up at your office. You do 5 or 6 things, and go, oh my gosh, I haven't felt this good in 5 years. I haven't felt this good in 9 years. Oh my gosh, I haven't felt this good in 30 years. I mean, it doesn't matter how long I swim upstream, as long as that's my result at the end, I'll keep swimming. And there was another question that came in. If you have a diagnosis of cancer, would it be better to put the castor oil pack on the breast? Still the liver. Still the liver. The liver is your detox organ. And without knowing a little bit more about your cancer, I would do both your liver and your breast, but I would absolutely do the liver and then the breast. I do the liver 3 or 4 times and then the breast. If you want some more particular advice about that, perhaps you should email me privately. Does getting the body regulated automatically chelate heavy metals, or do you recommend a particular protocol? Fantastic question. And then are your thoughts on zeolite or AL? So ALA is alpha lipoic acid, which is great. It's one of the 3 precursors you need to create glutathione. Glutathione is what your liver creates to help you protect yourself against metals and chemicals. It's the super antioxidant. It's a fantastic product that our liver makes, ideally 25 grams a day. But if our regulatory capacity isn't working ideally, then our liver cannot create 25 grams of glutathione a day. And I personally think that what I've seen clinically is that some folks need probably 50 grams of glutathione a day due to exposures, due to things that they're dealing with. So if my liver isn't keeping up with detoxifying on its own, that I need to assist it by doing a castor oil pack, or maybe getting my doctor to give me a naso, or getting my doctor to give me some neural therapy, or going to my acupuncturist and helping assist my liver, or doing some lymphatic drainage on my liver. and getting my liver to work better so it can be my first defense, along with my parotid gland, against metals and chemicals. As we are born as ideal zygotes when we are conceptualized, yes, ideally we have 10 fingers, 10 toes, and a perfect immune system. God didn't forget that part. You know, we didn't vaccinate our child. And when I have to go to schools and say, oh, what's your religious exemption? My religious exemption is, I don't think God missed the part of the immune system. I think he probably did it all perfectly. So the system should work perfectly unless there's a blockade. If there's a blockade to healing, then it won't work well. So I want to make sure I answered all parts of that question. But so ideally, yes, the body should regulate its own levels of metals. I go outside in Pennsylvania. It's the third highest level of airborne mercury in the country. When I go outside and breathe, I'm expecting my own regulatory capacities to detoxify that. But if I'm going to go and eat sushi 5 days in a row, and I'm going to go stand at the dental office and watch what they're doing to really look at that capacity, and I'm going to be exposed to all that metal, and I don't know, the crazy thing I could do, I don't know, go to a hotel and breathe all their Glade plugins, then yeah, I might do something to assist my liver if I'm maybe chronically ill. But at this point in my life, personally, I just assist my body a couple times a year by doing a detox protocol. There's no particular protocol I recommend. I do like zeolite a lot, as long as the person's bowels are moving. If their bowels aren't moving, do not use it. And if they have metal in their mouth, still you cannot use zeolite either. I find that it's a very good chelator. It's a very good like magnet, but almost too good if you still have silver in your mouth. There's no particular protocol. When we take somebody through a heavy metal detox, it's a 2-year, 3-year process, and it changes throughout the process. Sometimes it's IMD, sometimes it's chlorella, sometimes it's wheatgrass, sometimes it's just minerals, sometimes it's not doing any of that, allowing the system. Maybe it's taking cilantro, maybe it's doing some liposomals. It just changes. Maybe it's IV therapy. It changes throughout the process. Do I feel people are becoming aware and seeking out this form of medicine? Absolutely. I've been doing this now for 14 years. And well, in our own practice, and prior to that, I'd worked in another practice for about 6. And absolutely, people are looking for this more than ever because they're frustrated with the status quo. They're frustrated with, here, take this medicine, here, do this surgery, here, suppress that and stop complaining to me. It's the information age. People know that they can go to Dr. Google and get a lot of information, and they often know more than their doctor does about their case. So now's the time. We can educate ourselves in the autonomic nervous system. We can hand them some things they can do at home. We can change medicine together from the bottom up. That's the only way medicine is ever going to change. And it's changing because people are demanding their doctors know more. They're demanding their doctors understand the different types of testing for EVV, for Lyme. There's great books that have come across in the last 5 to 10 years, and great speakers like Wayne Dyer, which he's great. Bruce Lipton's amazing. And Joe Dispenza is incredible. And these docs are really on the cutting edge of getting people to understand in quantum physics and quantum neurology and understanding how the body actually works on a quantum level. And anybody has access to that. And when they go to their doctor and their doctor doesn't know about it, that's why medicine is changing, because the clients are demanding it. Patients are demanding it. And I applaud all of you on the phone tonight for taking the time out of all of your incredibly busy schedules to go ahead and be here on this webinar actively. I encourage you again to come to Dr. Sean's on August 22nd. Make sure you register for that, and I'll see you all in Baden-Baden. Have a great night.